Hi, my name is Sarah Viceretto. I'm a registered nurse in stem cell transplant and I'm holistically board certified. I currently practice at Hackensack University Medical Center. I've been in stem cell transplant for about 3 years. Before that, I was in solid organ transplant and urology for 10. So I have a couple years of nursing experience under my belt. As a holistically board certified nurse, one of my passions is speaking about preventing opioid misuse. I've had family loss directly related to opioid misuse, so this is a topic that is close to my heart. So I have the goal as a holistic board certified nurse to empower patients, family, friends on how to holistically plan the aging process that we all know and love to really give ourselves a more resilient foundation in the times of emergency when we know that we need opioids, so that way we can prevent addiction, misuse, and tragedy. So today we're going to be talking about planning holistic aging. Essentially, intentionally aging in a holistic manner where we understand that mind, body, and spirit are all connected, and we need to take care of all of those elements in order to be our best for when there are emergencies, marathons in life that we didn't expect, where we're going to need medical assistance and possibly the use of opioid medications. Today, we're going to be talking about holistically aging in general. I'll go over the pillars of health that we want to boost up as much as possible, integrating holistic medicine and traditional medicine, preparedness for pain. We know that there's always going to be some kind of intervention in life, whether it's a surgery, a procedure, an emergency, a fall, something is going to happen because that's the nature of being human. So how can we go into those events with as much preparedness as possible, including surgical preparedness? We're going to be talking about how to plan for procedures and plan for pain during those times when we essentially know that pain is a guarantee, including post-operative management. So first off, what is holistic aging? When we talk about holism, we talk about the mind, the body, and the spirit all being a connection. If one of those things is off its equilibrium, it's going to affect the other thing. So going into events that may be challenging, such as surgeries, falls, emergencies, etc., we want to have a foundation where our mind, our body, and our spirit are connected, and the foundation is as concrete as possible. And that means really striving for balance and well-being across our entire lifespan. When we talk about holistic aging, it is not anti-aging, very specifically not anti-aging. The goal here is not to try to age in reverse. We know that aging is going to happen. We want to age gracefully and with empowerment. We want to co-create intentionally what our lives are going to look like as we get older. And we know that all of these stages of aging, we know that our muscles are going to decondition as we get older, that we are at higher risk of osteoporosis and falls and balance issues. So can we plan so that way our body, our mind, and our spirit are as strong as possible to go into those events ready? For example, you wouldn't run the New York Marathon without ever training. We know that life is a marathon. Unfortunately, sometimes we don't know when the marathon's going to start. We're not so lucky that we can plan in advance, train for 6 months, be ready and prepped at all times. My marathon might start today. Yours might start tomorrow, and we might not get warning. So the concept here is that we strengthen our pillars of health so that when our marathon starts, even if it's without warning, we have a toolkit that's preparing us to get into that marathon with not just fear and anxiety and being unsure of what to do. We have a toolkit where we've worked our foundation, we've really put time and effort into our pillars of health, that during this marathon, even though we were unprepared, we're ready. Holistically, aging is inevitable. Every single year is a blessing. Can we consciously and intentionally participate in the process? Can we set ourselves up for success in trying times, which we know are going to happen? Life is not perfect, but can we go into that trying time with a little bit more of a foundation that sets us up for success? Can we develop healthy coping mechanisms to prevent misuse of unhealthy ones? And at the end of the day, the point of this conversation, which you'll see, is going into those times of trying and those times of our marathons with a bigger toolkit and a stronger foundation can prevent things like opioid misuse and overdose. So the first pillar that we're going to talk about is physically aging, including nutrition, movement, sleep, and preventative care. First off, with nutrition, we need to be focusing on fiber intake, whole foods, antioxidants that are cancer fighters, such as berries, nuts, fiber that's preventing colon cancer, GI cancers, rectal cancers, pre and probiotic foods that are maintaining a healthy gut microbiome, such as kimchi, high quality yogurts, kefir, hydration. Are we waking up and are we drinking coffee on an empty stomach every day and really setting your gut up for not a successful day? Simple things like adding protein before caffeine in the day balances your cortisol levels, can decrease the stress on your gut microbiome. And you might be thinking to yourself, where does that come into preventing opioid misuse? If you get admitted into the hospital for something simple like a fall and you're on opioids, your risk of constipation is higher. Your risk of constipation is going to compound with a pre-risk of constipation by not having a high fiber diet with whole foods, antibiotics, pre and probiotics. So now we're compounding maybe hip pain from a fall with pain from constipation. And the side effects of the opioids are going to be elevated because of the lack of a nutritional foundation. And those two things are just creating a cycle. So what we want to do is we want to go into those situations with a gut that is already healthy and a gut that can handle and tolerate some maybe side effects of necessary medications. It's also important to limit things like caffeine and processed foods. Some of these processed foods are directly linked to cancers. And part of preventing the need for opioids is by preventing things that can cause pain, such as decreasing your risk of cancers by limiting foods that you know are directly related to cancers, like level 1 carcinogens, such as highly processed foods like your cured meats. As delicious as they are, we have to take things in moderation because our goal here is to create a foundation where we're avoiding things that are avoidable if possible, in order to maybe not need opioids in a situation that we didn't call for. Movement. As we talk about aging, one of the things that you'll hear any medical professional talk about is decreasing the risk of falls. Part of that is because as we age, we're at a higher risk of osteoporosis, we're at a higher risk of bone fracture, so a higher risk of needing emergency surgeries, which after surgeries for bone and orthopedic issues, we're not moving, we're not ambulating as much. So now we're at a higher risk of things like constipation, blood clots, pneumonia. Going into those emergencies with more muscle tone, more strength, more balance, more flexibility, first off, can prevent those falls from happening. Secondly, if they happen, can help us recover better. And third, can prevent complications from a lack of mobility after those emergency surgeries. So movement is critical. Cardio can simply be walking. Now, I understand there are limitations. We have many individuals that might have disabilities that it's very challenging to get physical movement in every day. So my recommendation is you do a really true self-assessment. Look at what your abilities are, and every single day tailor a routine to your abilities that get some kind of elevation in heart rate. An intentional elevation in heart rate is what we're looking for. So for cardio, if you can walk, walking is a great start. Walking every single day helps increase your resilience physically. Strength training helps prevent loss of muscle tone and increase your muscle tone. So if you do end up with a hospitalization, you want to start off with as much muscle tone as possible, so that way you don't decondition as much in the hospital and your ability to go home rather than, let's say, an acute care rehab is higher. So strength training can be something simple. You want to do your self-assessment and see what's comfortable for you. But if you can strength train with simple water bottles every day and do up and down movements, those can be key to increasing your strength and your flexibility, your equilibrium and your balance. And flexibility is very important. As we age, we know that there's a risk in not being able to do our activities of daily living. And sometimes we still try to. We want to prevent injury from reaching up for something that is heavy, that maybe we don't have the strength to carry that heavy item anymore, which we're at risk of dropping on our foot or falling. Flexibility is key to preventing those injuries. So every single day, the stretches don't need to be complex, but waking up and moving your body sets you up for more success as you age, including improving your balance with things like Qigong, Tai Chi, yoga, Pilates. There are beginner versions of all of these exercises that you can start at to set your body up for success, where when that marathon happens that we didn't have any time to plan for, our foundation was already secure, including sleep. Sleep is a huge factor in resilience. Early and often, we need to be sleeping, going to bed at an appropriate hour. Everybody is different. Not everybody needs the exact same amount of sleep. So, same thing, doing a true self-assessment. How much sleep makes you feel at your optimal self? Is it 8 hours? Is it 10 hours? Depending on the cycle in life, that might be different. I have a toddler right now, so sometimes it's about 4 to 5 hours, and that's not enough. And I know it's not enough. So I try to prioritize and change our routine to optimize sleep as much as possible. A consistent routine is key. When we talk about consistency, the reason why you really want to balance your sleep into a consistent schedule is because of that hormonal peak cycle. You want your natural circadian rhythm to be as fluid as possible. Having alternating sleep schedules where one night you go to bed at 9 p.m. and one night you go to bed at midnight can be very confusing for your circadian rhythm and for your body's natural ability to make melatonin. So I highly recommend that you have a consistent sleep schedule where the goal is about the same time every night and the wake time is about the same time every day, regardless of day of the week. That can be hard, so an hour either way is understandable, but a goal is to have a bit more consistency. And sleep should be intentional. As I take care of many patients, and I've taken care of many patients throughout my career, I've seen a lot of individuals have issues with staying asleep. And many times they're falling asleep watching TV on the couch at 7:30, 8 o'clock at night, and then go into their bed, sleep for maybe a couple hours, wake up at 2 or 3 a.m. and can't go back to sleep. The key there is that unintentional sleep is now messing up your sleep-wake cycle. So sleep needs to be intentional. When you feel tired, the goal is to get off the couch, get into bed, turn the screens off, scroll through a magazine, read a paper book, something that's not giving you blue light in your eyes. Intentionally wind down the day. My recommendation is at minimum 30 minutes before bed. You really shouldn't be doing anything that is overstimulating your brain, including all screens. Many experts recommend 2 hours. However, we do know that that is challenging depending on the time that your day ends. And as a shift worker that works in bedside nursing with my 12 and a half hour day, I know 2 hours is not always realistic. So 30 minutes before bed is my personal goal to just decompress, no screens, everything's on do not disturb, and intentionally wind down. The routine and prioritizing sleep is key. And when those marathon events happen, you do want to have a healthy sleep pattern. I understand when you go in the hospital, you're not going to have a healthy sleep pattern for the time that you're in there, but your foundation of good sleep is important for the cells in your body to be able to handle unplanned events to increase that resilience. So that's why we're talking about sleep. Preventative care is also critical. Being on top of your routine screenings prevents things from going off the rails, and then we're doing more interventions that we wouldn't have been doing if we were able to catch them earlier. So going to your primary care doctors, being proactive about your screenings, and doing risk-based vaccinations. As we age, it is very important that we have conversations with our primary care doctors about what our life looks like. If you have grandchildren and you live anywhere that has a pneumonia, flu, RSV, cold, COVID season, RSV vaccinations are recommended. RSV vaccinations can keep you out of the hospital. Keeping you out of the hospital can decrease your risk of some things that cause complications like blood clots, pneumonia, DVTs, PEs, and those things can require opioid pain medications. So it's all connected. The goal is that you prevent the root diseases that can cause complications, such as pain, that can cause the requirement for opioid pain medications, which can be very, very necessary during acute pain. But you want to be able to have the toolkit prepared that if in those moments you do need pain medications, you are still stronger and have a good foundation to be able to not utilize them long term unless completely necessary. So risk-based vaccinations is important as that entire cycle is all together. Preventing something like RSV as you follow it down the line can prevent opioid misuse. Physically, once we have our foundation intact, we do want to talk about cognitive aging. As we said, mind, body, and spirit are all connected. Your brain is directly connected to the way that the rest of your body functions. So we need to be working on our learning, our stress, our stimulation, our regulation every single day as complex human beings. We are lifelong learners, and keeping that energy of being a lifelong learner keeps your brain fresh and young in the sense that you have to exercise your brain in order to keep it going. There's a phrase that people say with languages, when you learn a new language, if you don't use it, you lose it. The brain is like that. Your skills will deteriorate over time if you don't use them. Being active in courses, hobbies, and being curious about new things in life is very, very good for stress management and for cognitive learning and for keeping your brain at peak performance. And that is also critical for making decisions as you age. You want to be able to have your brain be a strong muscle so that when your marathon event happens that you didn't know was going to happen, you can clear your mind and make decisions appropriate to your care in good consciousness. Stress management is also critical to preventing opioid misuse. This is connected the same way that everything else is connected in one big cycle. As you manage your stress, you are increasing your resilience to those stressful once in a lifetime events. Those once in a lifetime events can create such a high stress moment and can really pull people out of who they normally are, where they can end up using opioids inappropriately. So managing routine daily stress increases your general resilience and your foundation to be able to handle those once in a lifetime events. Doing things like mindfulness, I personally use the Calm app. I'm very grateful that my company provides the entire pro membership. So I use the Calm app every single day. And mindfulness gives you the ability to self-reflect and be self-aware and disconnect from the noise in the world that sometimes just takes up too much space in your head and doesn't allow you to connect and focus and set appropriate goals. Intentional breathing. When we have scary decisions to make, when there is a doctor giving us maybe a lab that's not the best or a new result that leads us down a path that we didn't know we're taking, step number one is intentionally breathing to drop your heart rate, give yourself the ability to listen and focus and hear what they're saying. Your cortisol balance is very important. Cortisol is a key hormone in life. It should not be constantly low. Cortisol is necessary for life, but the idea is that we don't want to be living in a constant state of worry and a constant state of fear. So self-reflection and self-awareness gives us the ability to tone that down a bit so we can be a bit more calm, which is better for our heart rate and our blood pressure and our overall stress levels. Cognitive stimulation is very important. As we talked about before, your brain is a muscle. You want to be able to exercise that. Your neural pathways are constantly growing. We talk about children. I told you I have a toddler, I have a 4-year-old. We talk about in children and raising them, we talk about their neural pathways, how we want to constantly be teaching them so that their pathways are connected. That doesn't stop. Just because we're aging doesn't mean that we just want to let our pathways disappear and not manage them. We want to be constantly strategically thinking, critically thinking, challenging and expanding our brain. And this could be something so simple as doing Sudokus and crosswords every day, as taking a new course that you see that's teaching about a topic that you've never learned about. Keeping these important curiosities in life going is critical for empowering your personhood and your personal self. And your self-regulation is the number one thing to really preventing opioid misuse because your self-regulation is what teaches you healthy coping mechanisms. Your ability to understand what you need to regulate as an individual is going to create a wall. You want that wall to be up where opioids don't have power over you. And we're going to talk about this a bit later when we talk about hormones, but Opioids are hijacking the essential hormones in your body. They are necessary to control pain. There are many times where you need opioid medications to put yourself in an optimal physical situation with pain so that you can ambulate, move around, function as an individual. The goal here is not that we're not using opioids. It's that we're using them appropriately and we're not allowing them to hijack our hormones and take over our decision driving factors. Being aware of your triggers and being self-reflecting and self-aware gives you the ability to identify when something would put you at a higher risk. So self-regulation is directly connected to preventing opioid misuse by giving you that wall of strength to be able to identify when maybe something is turning into an addiction or a dependency. And I highly recommend talk therapy because it gives you the ability to get out some of the frustrating concepts in your head and work through what is necessary to create that self-regulation wall. Your emotional health is directly connected to your physical health. Remember, we said mind, body, and spirit, they're all connected. As we age, it is key that we are being on top of our emotional health. There are times when your life is going to change. Retirement is one of the biggest stressors for individuals in their lifetime. You're changing the entire trajectory of your day. So prior to an event like retirement, are we being sure that we're strengthening our community? We are developing purpose outside of our careers. What is motivating you to get up every morning? Do we have internal purpose that is driving our movements? How are we expressing our emotional health? Are we keeping it all bottled in so that way when something happens, we explode? Are we keeping all of our emotions in our shoulders and our back? Are we having full body pain related to emotional health not being expressed appropriately? And are we connecting with individuals and connecting with each other? Community is critical. Planning holistic aging, one of the biggest things that I can say to you as seeing many, many patients over the past 13 years, you need to develop community. Your marathon moment is going to happen. Whether it happens in 5 years, 10 years, or tomorrow, we very often don't know. Sometimes we do know. Sometimes we have a major planned surgery. Sometimes we have a diagnosis that's been chronic and we've been working on it for years and we know that there's a certain situation going to happen. Community is key. I've seen many patients that go into situations with no help. That is extremely risky. It's risky for many, many complications that can happen after being sick. It's a high risk of depression, of suicide, of opioid misuse. Having community is key to having nurturing relationships, having groups that support each other, having teams that can come and support you if you need a ride to the doctor, a trip to the hospital, if you need somebody to pick you up from the hospital. Those things sound simple, but as we age, it's important that we're fostering community to ensure that those things will be in place when our marathon event happens. And having meaningful relationships is key to having purpose in life. And purpose matters. Purpose is what gets you up in the morning. And purpose is directly connected to preventing opioid misuse because many times, as we talked about, opioids will hijack your hormones. They will give you certain feelings depending on what you're taking that can make you feel in a certain way. And if you didn't feel that way before, it's a higher risk of creating a dependency. Addiction very often is related to utilizing one medication outside of the scope of it being ordered to replace either a feeling, an emotion, to deal with something as a mask, to suppress something. It very often happens. And many times that happens due to other high risk vulnerabilities that we'll talk about in a bit. Part of the things that we need to do as a person in fostering our personhood, in fostering our resilience, and empowering ourselves is driving purpose forward. As we get older, our purpose often changes. We talked about retirement. Many times, as we age, we realize that we spend a lot of time maybe focusing on our career. As we're planning retirement, there are so many things that you can do that will increase your purpose without a career that you can also do during your career, things such as volunteering. If you're not physically able to volunteer or you have any other kind of situation that's blocking you from volunteering physically in person, which is a good idea to increase community, there are other ways that you can volunteer without having to go be in a community food bank, as the picture we see here. There are many telehealth volunteering opportunities. There are virtual opportunities. There are volunteers for many different organizations that simply need somebody to help organize paperwork. Things like that can be purposeful and can give you drive and help answer the question of why do I get up every morning? Mentoring is a good opportunity. As you retire, something you consider is staying on as a mentor, even if it's an informal mentor to somebody that you have left a career, but you know that they have a really great career ahead of them. Honing in on your passions can help find that purpose every day. And having that purpose can help with emotional expression. As we talked about before, when your emotions are pushed down as far as possible, they are going to manifest in some kind of manner. It's very common to hear about them manifesting in nausea, vomiting, diarrhea, muscle pain, fatigue, body aches. Emotional expression is key. Find your safe space, whether that's somebody in your family, someone in your community, a hired professional. It's necessary. As a human being, we are complex creatures. We need to have a safe space to let our feelings, our reflections out without judgment. It's critical that we connect to ourself in order to be able to connect to others, our environment, to be fully present. Being fully present in our everyday helps prevent opioid misuse in the sense that it's all connected. When we're fully present, we are fully engaged, we are connected to ourselves, we're very self-aware, we have a strong community, we have the most foundational environment possible. When your marathon event happens and you need acute pain medication, your foundation is strong. So that acute pain medication can be used appropriately and not turn into a misuse risk. Spiritual health, mind, body, and spirit, all connected. I'm a broken record. It's very important that spiritually you are connected to your own values. Who are we as people if we don't act upon our values? Peace, inner peace helps increase your resilience. You're not living a life of worry. When you feel true inner peace, gratitude, and you reflect and you have values that match what your life looks like, you have a stronger ability to create that wall of resilience. And by inner peace, it doesn't mean that there's no problems. We live complex lives. Of course, there are problems. Inner peace is the ability to connect to the outer stressor, but not let it derail you. Where your inner silence is strong enough that you can withstand the storm. You know the storm is coming, but your mantra is no matter what happens, I can handle it. I can handle anything. And you have your trigger awareness. You know what's going to make you feel as if your inner peace is getting rocked. And when you feel that trigger awareness, you can dial back in and you can increase your resilience and you go back to your toolkit. What are the things that work for you that increase your resilience and increase your inner peace? Every individual person needs to have their own toolkit. So whether it's meeting with your family, that can increase your resilience because it's connection to people or connection to self. If it's journaling and brain dumping, you have to create your resilience toolkit in order to be able to manage those marathon events that we didn't know were coming. One of the toolkit items that I highly recommend is a daily gratitude practice. Gratitude is directly related to stress. And the more that you keep your stress under control, stress is important, stress is healthy, but you do not want stress to own you. You want to own your stress. And gratitude daily practices, such as starting your day, looking in the mirror, and you give yourself 5 things that you were grateful for. Whether it's 5 things I was grateful for yesterday, 5 things I'm grateful for in my general life, 5 things that I'm grateful for coming up in the future. You start your day with a sense of gratitude, or you end your day with gratitude. Everybody works differently, but a daily gratitude practice is directly related to your inner resilience. Having a positive outlook is critical. Working in stem cell transplant, I work with many oncology patients that are going through the hardest time in their lives, the hardest time in their diagnosis. I will tell you from experience, the individuals that wake up with goals, that know every single day they're going to take each day at a time. And sometimes it's not even taking the whole day at a time because it's so challenging. It's taking a bite of each day at a time, creating a small goal, hitting that small goal, focusing on those small wins. That outlook changes people's course. It gives them the ability to get out of bed, to walk around, preventing those complications that we talked about: pneumonia, blood clots, DVTs, blood clots in your lungs, all of those risks of a lack of mobility. That's directly related to your positive mindset. And an opportunity mindset. We know that these marathons in life are going to happen. You're human. We want them to happen. It would be boring if nothing ever happened, and everything can be an opportunity. Now, sometimes the opportunity is to learn from the pain, right? We know that the worst things could possibly happen. Sometimes they happen. And the opportunity mindset isn't toxic positivity. We're not saying like, oh, I'm going to have this incredible, great experience out of the most traumatic moment of my life. It's more, I've had a really traumatic moment in my life. I'm feeling the trauma. I am letting it be part of who I am. And I'm learning from the things that happened during the trauma, from the healing process, from the talk therapy. And I'm going to come out on the other side with skills to manage these traumatic events, with more things that I can put in my toolkit that's creating a resilient wall that I know that I can handle anything because look, I just did. That's an opportunity mindset. And having a true contentment with who you are as a person decreases your risk of being hijacked by those opioids because it's giving you the strength, the power, the ability to say, I'm empowering my own care. I'm making my decisions, and I am not going to let this opioid hijack my hormones and take me over. Part of that is reflecting. One of the things you can have in your toolkit is journaling and debriefing, or doing a walk in their shoes practice, which is where you write out something that is maybe challenging to you. If you're having difficulty with a coworker, a family member, you write out and brain dump on paper what would it be like to walk in their shoes. And that can be very helpful to being not only self-aware and self-reflecting, but aware of individuals around you. And sometimes we just need to realign. When we know that these events are going to happen, your mom is in the hospital, all of a sudden your kid fell and broke their arm and now they need surgery, and then your car breaks down and the taxes are due. All of these things are always happening at the same time because we're human. Having the ability to realign during those stressful moments makes them more manageable. And when we talk about values, we talk about our daily actions and our core values having integrity and matching what our life looks like. So when I say the 3 Ps, as you'll see on the screen, I'm talking about people, places, and process. Do the people that you surround yourself with align with your values? The places that you bring your energy to, does that align with your values and align with who you want to be as a person? And the process, the way that you get somewhere matters. As a human being, from step A to step B, you don't want the middle trajectory to not align with your values, because then when you get to step B, even if step B is the promotion, the award, the accolade that you wanted, if the way that you got there doesn't align with your values, that's not contributing to being a resilient, holistic person. All that's doing is creating cracks in the foundation. So part of what we talk about in values that matters is having integrity, and you practice what you preach. Your daily actions reflect your values so that your personhood is strong. And having strong personhood prevents those opioids from hijacking your personality. Environmentally, your safe living space is key for having the ability to feel comfortable. But when we talk about safe living space, there's always going to be challenges, right? We're very well aware that there are individuals that are unhoused. Using resources that you have to create a community by contacting the state, talking to social workers, all of those things is critical because in order to really have soul security, we need to be in a safe living space, in a as non-toxic of an environment as possible. So that includes not smoking, not using harsh chemicals, opening the windows every day if you can. Right now it's like 9 degrees where I live, so I open the windows for a second and I close them right back, but it's still important to be able to have fresh air, minimizing all of those complications that can happen from being in stuffy, crowded environments. Florence Nightingale, one of what we call Mama Nurse, she introduced the idea of your environment really being key and connected to who you are in as a patient in a healing process. She introduced opening up the windows, putting art, which seemed like it wasn't important at the time when you had these soldiers who were recovering from infected wounds, but your mind, body, and your spirit are connected. So opening the windows and giving them interesting things to look at and think about and talk about with their fellow patients, their nurses, that fostered their healing. So are we doing that in our lives? Are we fostering our personhood by having as healthy as health promotion of an environment as possible? And that includes minimizing injury. We talked about preventing falls. Look around your space. As you age, we need to be adjusting the space to the aging process. So removing trip hazards. There shouldn't be extension cords going from one room to another. There shouldn't be rugs that are folded and putting us at risk of falling, and preparing for that aging in those procedure processes. If we know that, for example, I have a hip dysplasia problem since I've been a kid, since I was a baby. I know I have a hip replacement coming up in my future, probably in the next 10 years. As that's going to happen, I'm going to rearrange my living space to plan for that. And that's part of planning holistic aging, is that we know we're going to age. We know at some point we might need to be in a wheelchair. We might need crutches. We might need some support. So optimizing the space where if we do have a house that has a full flight of stairs just to get to the front door, it's a good idea to think about, what would the plan be if I fell, broke my hip, had surgery? What would the plan be? Where would I stay? How would I get up to the first floor? Thinking about all of those things in advance is very helpful, because then when that marathon event happens, we at least have some kind of process in place. Accessibility to care is also key. As a stem cell transplant nurse, we have conversations with our patients all the time that I need you within an hour of the facility. And that is for your benefit. That's because in order for us to provide the best possible care, you need to have access to care that's specialized to you. So as we're aging, considering things like, where do we live? Do we live close to family? Do we live very far from family? Do we live close to a major medical center? Are we only close to a community hospital? These are things that are very beneficial to think about before those major life events. So if you maybe have only one child and that child lives 4 or 5 hours away, as we're aging, it is beneficial to consider, is that most optimal plan for our future, for our children's future? And just thinking about, what does our support system look like now, and what should it look like to be the best that it possibly could be? When we talk about a non-toxic environment, there are many things that we don't have control over. There are environmental pollutants that are not directly our choice, but we're going to control the things that we can. So no smoking. This picture is a plate of cigarettes next to broccoli. And the reason why that's there is because there are chemicals in broccoli that are directly related to reducing the risk of lung cancer in smokers. So part of that is decreasing your known carcinogen risks while increasing foods, lifestyle habits that are known to prevent cancers. Limiting your known carcinogens as best as possible, reducing pollutants. So if you live maybe close to a area where there are high pollutants, for example, PFAS in your water, installing a water filter if possible and financially feasible is something that you can do. And then household products, limiting the most toxic household products as possible. There are cleaners that are very efficient that do not expel more chemicals into the air. Personally, like utilizing vinegar as much as possible. You're going to need bleach for some things. That's just the way that it works. But can we maybe change our routine daily cleaning into something that's a little bit less toxic, so that way when you do your every 2-week deep clean, you can use those products, open the windows, and feel more comfortable that your entire house is not fully masked in chemicals 24/7. Connection to nature is key. Fresh air, we talked about opening the windows, getting outside, connecting to nature. That really helps give you movement, introspection, and external peace. And all of that promotes security in your personhood. And security in your personhood is the number one thing that gives you confidence, control, gives you the ability to set boundaries that work for you, which increase your resilience, which increases your stability as a person. So the more confident that you are in setting those boundaries, maintaining those boundaries, the more resilient you are in those marathon events, and then the more stable your outcome can be. And the reason why all of that matters is because some risk factors for substance misuse are risk factors that directly impact personhood. So your family history of substance misuse is unfortunately increasing your risk of substance misuse. And working on your personhood and strengthening that foundation can change the cycle of that family history of misuse. Mental health disorders such as ADHD, depression, anxiety, schizophrenia, bipolar disorder, manic depression, those all put individuals at a higher risk of substance misuse. And that's directly related to many of the inability to create those healthy coping mechanisms and the inability to create a resilient environment where when those substances are introduced, they take over. Trauma and adverse childhood experience and some personality traits like impulsivity, distraction, non-contentment, those things which are very often related to trauma and adverse childhood experience, those increase. Those are your risk factors for substance misuse. So when we talk about planning holistic aging, how does that prevent addiction? It prevents addiction by creating those healthy coping mechanisms, increasing your resilience, increasing your community, and increasing your internal well-being, where your individual personhood has that wall that you can handle those marathon events that maybe introduce opioids. Or it also creates your wall of control and boundaries when people, places, and process, if they're not people, places, and process that match your values, that possibly introduce something like opioids, you have the strength, the control, and the boundaries that you're saying, no, I'm not being introduced to those substances outside of a appropriate, prescribed, necessary medical manner. And part of that is the connection, the accountability, and the awareness. Having the ability to be self-aware and self-reflecting, internal and external accountability is important in this process. When we talk about prescribing opioids, an element that we talk about as prescribers is having another individual be accountable where they're aware of what your pain regimen is. So that way we're making these decisions together. If we're utilizing Tylenol on a schedule and we're utilizing oxycodone for breakthrough pain, having another individual be aware of that breakthrough pain schedule increases internal and external accountability. So when we talk about hormones, can practicing a daily dose, DOSE, for pain prevent substance misuse? And this is where we talk about narcotics, opioids, controlled substances impacting your hormones. So dopamine, oxytocin, serotonin, and endorphins are all happy hormones. Practicing a daily dose where you use your lifestyle to increase your dopamine, your oxytocin, your serotonin, and your endorphins is increasing that wall of resilience, increasing your happiness, your personhood, your strength, your resilience, and that is going to decrease your risk of misuse. So when we talk about dopamine, it's directly related to motivation, learning, and pleasure. Oxytocin is the love hormone, so that's related to trust, motivation, sustaining relationships. Serotonin is directly related to your self-acceptance and social acceptance, so that one is critical when we talk about peer pressure and having your control and your boundaries to be able to reflect peer pressure if a situation comes about where you might possibly be introduced to non-prescribed opioid medications. And then the last happy hormone we're going to talk about is the endorphin, which is directly related to euphoria. So when we talk about dopamine, the goal here is that you know your body's dopamine cycle. You know what gives you that dopamine hit, and every single day you are doing things that increase your dopamine without a synthetic substance. So that when a synthetic substance might be introduced during those marathon events, such as morphine or heroin, which we hope they don't get introduced inappropriately, but when those substances might be introduced, let's say morphine after surgery, you are not experiencing this dopamine flood for the first time because you live your life full of dopamine. So you're at a decreased risk of falling into the hijacking trap, per se. So our goal here is that we're promoting dopamine in our own lives every single day through exercise, connection to nature, music. We're dancing around in the living room. That increases your resilience. Diet, sleep, and sunlight. All of those things are directly related to giving you a dopamine boost to increasing that personhood we talked about. Oxytocin, the love hormone, you hear this often in mommies and babies. Oxytocin is directly related to trust, motivation, and sustaining relationships. Oxytocin boosts are from touch, intimacy, time, kindness, connection, laughing. All of those things are directly related to boosting your oxytocin. And the goal here is that you know the pieces in your life that bring you oxytocin boost. So if you feel like you're having maybe a low day, if you're just grumpy, not feeling great, and feeling like maybe your mood is starting to drop and you're possibly at risk of seasonal depression, standard depression, having a toolkit where you increase your own oxytocin by knowing what things work for you is critical. Then what that does is it empowers you and gives you control to be able to boost your own oxytocin so you're not turning to a synthetic ingredient to do it for you. Serotonin is another one that we really want to be thinking about when we're talking about boosting our own happiness. Serotonin is directly related to your own acceptance and social acceptance. Diet. Tryptophan foods like fatty foods like fish, cashews, peanut butter, all of those fatty acids directly are related to making more serotonin in your body, including exercise, typically more high volume exercise like jogging, maybe even doing like burpees, which are hard, but if you can't do them, walking is more than enough. It just intentionally increasing your heart rate and getting direct sunlight. Every single day, I shoot for getting 20 minutes of direct sunlight, which is not always a possibility, but even if you get 5, the goal is that you try and that you start somewhere and work your way up. So that way, when there's medications that impact this process, like tramadol, methadone, fentanyl, the goal here is that you're not letting those medications hijack your hormones. They will do what they need to do. They'll be used appropriately in the appropriate medical setting, appropriately prescribed, but they're not taking over your entire hormone drive because you already manage your hormones yourself. And your endorphins. Endorphins are your happy hormones. They're exercising, dancing, massage, acupuncture, laughter, and again, sunlight. Medications that affect your endorphins like Percocet, Vicodin, morphine, fentanyl, same thing. The concept here is that you don't want to give the opioid the power to hijack your hormones. You want to have full control of your hormones where you already have a toolkit in place to ward those off. You're going to need to use them appropriately, but then the idea here is that we're decreasing our risk of misuse by being able to transition into our toolkit of all of the things that work for us as we're coming off of appropriately prescribed pain medications. Going into procedures and surgeries where you know there is going to be pain, number one thing that we need to do as patients is develop an appropriate pain expectation and have a full-length conversation with our providers about pain. So going into a scheduled surgery, you are going into it knowing that there is going to be some kind of discomfort, some kind of pain, because this is an intervention that your body is not expecting, not used to. For example, abdominal surgery, there's going to be incisions through your abdominal muscles. So we know that there's going to be pain when you're coughing, laughing, sneezing, walking, getting up out of the chair. So conversations with your surgeon and your provider prior to surgery is 100% necessary. The conversation as a patient needs to be, what is our goal? What is our goal for pain management after the procedure? I, as a patient, am not expecting a zero of pain. I know that there's going to be some discomfort. What is the goal for me to be able to ambulate to prevent those blood clots, pneumonia that we talked about? What are we going to do to ensure that I can mobilize as best as possible? And what non-opioid foundation am I going to have? Am I going to have Tylenol scheduled around the clock? Can I have Aleve or Advil if it's appropriate, depending on the surgery? Can I have a lidocaine patch in place? Because that can help decrease the surface pain after the surgery. Is there going to be a nerve block? Are there any kind of anti-nerve medications that can help decrease some of the overfiring of the nerves after surgery? There are many options, different anti-inflammatories. So the conversation as a patient, you want to be empowered to have your provider co-create the plan of care with you. And it's also key that your provider knows what your opioid goals are. I want to be comfortable so that I can ambulate after my surgery, but I am concerned about opioids having a risk of dependency. Can we be sure that my plan is tailored, that I have a foundation of non-opioids and we're utilizing opioids only if necessary so that I can decrease my risk of dependency? And managing pain after the procedure, depending on the type of procedure, the number one thing I always have my patients do is get up and ambulate as soon as safely as possible and as often as possible, and increasing movement, even if that means that they can't ambulate. So that means if we're sitting in the chair after surgery, we're doing arm movements, we're doing leg lifts, we're improving mobility as much as possible. Scheduling those non-opioid medications when you're home, let's say you have abdominal surgery, when you're home, writing out every 6 hours your Tylenol and then utilizing your opioids for breakthrough pain, and having your trusted caregiver be on that plan with you. So that way you 100% have control and capability of your plan of care. Positioning and elevation, talk to your surgeon, talk to whoever's doing your procedures. What are the best positions to really take pain off of my incisions? What's the most comfortable way that you think I should sleep? Should I be splinting with a pillow when I get up if I did have abdominal surgery? Depending on the procedure that you have, these instructions are going to look different. So in those conversations with your surgeon and your care team, we need to be talking about managing that pain after your procedure, including increasing your ambulation and your movement. One of the number one things that I have patients do after surgery is get out of bed as soon as safe as possible, and increasing their movement as many times a day as they can tolerate to really mobilize the blood, increase healing. And we're using those scheduled non-opioid pain medications. So when you're home after your procedures, having a calendar of those times of your Tylenol every 6 hours, maybe the nerve medication that they added, having a written down plan that is with your trusted caretaker at home. So that way you have somebody else that is on the schedule, looking at what all of our options are, and then you're only utilizing those opioids for breakthrough pain. And the goal there is that the opioid is giving you the physical ability to mobilize more and to function better, but we're not using the opioid to stay in bed and not move at all after surgery. We want to use them to be able to function more, to increase that mobilization, that healing, decrease the risks of the pneumonia and blood clots that we talked about. And positioning and elevating, depending on the type of surgery that you've had, communicating with your provider on what's the best position for me to sleep in. What are some positions that will be more comfortable with my incisions? Should I be elevating a certain body part? Should I be utilizing a pillow to splint when I'm standing if I have abdominal surgery? And practicing the nutrient-dense nutrition post-surgery is equally as important as preparing prior. So nutrition prior to surgery, you want to be eating as much protein and going into the surgery as strong as possible. But after surgery, those things matter equally as much, where you're wound healing. In order to promote the best possible wound healing, we want to have balanced blood sugar, increased protein, and a nutrient-dense diet. And then after your surgery, you're utilizing your mind body toolkit and your pre-practice techniques. So you're utilizing those things like meditation, acupuncture, if appropriate after the procedure, journaling, connecting with yourself, connecting with your individual team members on your care team, with your trusted care provider at home. You're walking, you're stretching. So you have your mind body tool technique and you've practiced these things in advance. For example, going into labor. There are many, many individuals who go into labor with a mindset that they don't want to utilize an epidural. And in order to do that, they pain prepare. So things like using ice on your hands to increase your pain tolerance, knowing that you're going into labor and delivery with that goal. Now, do you need to be doing that every single day? Probably not, but talk to your care team about it. Are there things that you can do that are pre-practice techniques to increase your self-understanding and your self-awareness and your resilience to pain, that when the pain happens, when the procedure happens, you have a realistic expectation of what your pain goals are, and you have a toolkit ready where you know these are some things that I can do to manage my pain, distract me from my pain, promote healing post pain after I have this procedure done. The goal with this entire conversation is empowerment. Self-trust, self-love, self-control, they all increase that wall. So the idea here is we know those marathon events are happening. We know that there's going to be a time where we're going to end up in a hospital. We're going to end up needing care. There's going to be some kind of time in life where we're going to need an opioid prescription to get us through these issues. If we have chronic issues, we know that I need a regimen specifically tailored to me as an individual with individualized care. How are we going to empower ourselves to utilize our personhood to prevent misuse? And the idea there is that you're living your life in a manner of keeping each pillar as strong with a foundation as possible, that you have things in your toolkit that empower you to be able to be ready for those marathon events as much as possible. So that way we're going into those emergencies, those moments that we didn't know that we were going to be in a hospital bed with some things to help get us through it. Having control is not always possible, but the idea is that we want to empower ourselves as much as we could going into those marathon events. Thank you very much for your time and attention today. I appreciate your efforts in listening to this talk on this very important topic of being able to holistically plan our future and being as empowered as possible to creating our resilience wall for those marathon events that we never know are going to happen. So I hope one day when there's a marathon event happening and you have your toolkit ready, you think of me.